Dermal fillers are used to fill lines and wrinkles and folds on the face. They also add volume to areas like the lips and the cheeks. Nowadays, most dermal fillers contain hyaluronic acid, a natural ingredient found in our skin already. So this means that it's rare that we would ever have an allergic reaction to it. The hyaluronic acid used in dermal fillers is a synthetic, stabilized, non-animal version. The treatment areas that dermal fillers are used in are typically the folds between the nose and the mouth, the folds beneath the corners of the mouth known as the marionette lines, the cheeks. As the skin drops, the cheeks flatten and the skin gets loose on the lower jaw area. So if you put some volume back into the cheeks, it lifts the face back up and the lower jaw isn't as loose. If you do dermal fillers in the cheek area, you'll find that the fold here between the nose and the mouth is not as deep. They can also be used on upper lip areas for smokers' lines and on the lips for augmenting and increasing the volume of the lips. They're the typical most popular areas that dermal fillers can be. The hyaluronic acid in the filler is a clear sterile gel and is delivered into the treatment site by injection. Topical numbing cream can be applied for 30 minutes prior to your treatment just to increase your comfort levels, just so long as you're not allergic to lidocaine numbing agent. Usually more than one injection is required, no matter what area you're having treated. Sometimes there might be a little bit of swelling after the treatment. If that's the case, we can put some ice on the area. Usually we would wrap the ice pack in some tissue before we'd apply it on the area in order to keep the area sterile. The lips will be more prone to more swelling. So when you have lips volumized with dermal filler, about 10% of the volume that you will see immediately afterwards would be swelling. But that swelling in the lip area would go down about 24 hours later, but can stay a bit longer. Immediately after your dermal filler is injected, your practitioner will mould the area and massage away any lumps that might be present. Typical side effects include tenderness at the injection site, swelling in the treatment area, and possible bruising. What's the chances of getting a bruise? Well, if the needle punctures a vein on the way in, you will get a bruise, and if it doesn't, you won't. So the risk of getting a bruise is simply pot luck. So my recommendation is expect a bruise, and if you don't get one, then you're lucky. Here are some tips to prevent bruising. So for 5 days before your treatment, don't take anti-inflammatory medications such as aspirin, naproxen or ibuprofen. For 2 days before your treatment, don't drink any alcohol. For 3 days before your treatment, don't take any vitamins such as vitamin E, omega-3, omega-9 or ginkgo biloba. For 3 days beforehand, don't drink any green tea. And for 5 days before your treatment, do take arnica supplements, and all of those elements will help prevent you bruising. All injections carry a risk of infection, so for 12 hours afterwards, it's imperative that you avoid touching the area. You don't put makeup or moisturizers or any creams on the treatment site at all for 12 hours. And also you have to put on a clean pillowcase that evening, and that's just to keep the area sterile and to prevent infection from happening. Even if you do carry out these sterile measures, there is still a possibility that an infection can get in. If that happens, you will have to take a course of oral antibiotics to try to resolve the infection. Nowadays, with the increased resistance to antibiotics, in the event that you did not respond to the antibiotics, you may indeed need the dermal filler dissolved to resolve the infection. To dissolve a dermal filler, an enzyme known as hyaluronidase is injected into the area to dissolve it. A patch test for hyaluronidase is absolutely essential because it carries some severe risks, including anaphylaxis. So you never have a dermal filler done with the whole notion of having it dissolved if you don't like it, because of these severe risks. Hyaluronidase will dissolve not only the synthetic hyaluronic acid dermal filler, it will also dissolve your own natural hyaluronic acid in your skin, which lubricates, hydrates and gives your skin elasticity. So that's something you don't want to inject into the skin if you can avoid it. Dermal fillers don't last forever. Depending on the density, they can last from 6 months to 18 months. So sometimes you're better off letting the dermal filler reabsorb itself naturally rather than risking the hyaluronidase antidote to dissolve it. There are some very rare complications that can occur with a negligent practitioner, which can give rise to severe complications. And they include a blocked artery. A negligent practitioner might inject dermal filler into an artery and block the artery, which then in turn stops the blood flow to the skin and causes skin cell death known as necrosis. Now, this should not happen if the practitioner is observing protocol. A conscientious practitioner will always aspirate the syringe to ensure there's no backflash of blood into the syringe, and will ensure they're not in an artery before they inject. And this means you can safely inject without blocking an artery. So this complication is really rare, but it can happen. If this does happen, and if an artery gets blocked with dermal filler, that dermal filler must be dissolved to resolve this complication, and this will prevent skin cell death from occurring. And you will see on the internet some pictures of skin where it goes black in an area where dermal filler has been injected, and that's where skin cell death occurs as a result of an artery being blocked, which shouldn't happen in the first place with a conscientious practitioner. The rarest complication of all, but the most severe, is filler-related blindness. This happens where the filler is forced into an artery and the filler travels up to the artery of the eye, the retinal artery, and blocks the blood supply to the eye and causes blindness. This has usually occurred in non-reversible fillers, so basically fillers that are not hyaluronic acid based. Most of those complications have occurred in either that or in fat transfer injections. So you're safer using reversible fillers, hyaluronic acid fillers, to avoid this complication. It's incredibly important to choose a reputable clinic for your dermal fillers, a clinic that will fully inform you on all aspects of your treatment and also provide you with an antidote to any complications that might arise.